Skeleton system divides into axial and appendicular skeleton. Appendicular skeleton consists of bones of upper and lower limbs, pelvic girdle and shoulder girdle. Upper limbs, lower limbs, pelvic girdle and shoulder girdle, they all includes in appendicular skeleton. There are total 126 bones. Starting from the upper limb, we categorize upper limb as upper arm, forearm and hand bones. In upper arm, humerus is present. In forearm, radius and ulna are present. In hand, 8 tarsals, 5 metatarsals and 14 phalanges are present. This is upper limb. We categorize it as arm, forearm and hand. In this arm area, only one bone is present called as humerus. Below elbow joint, two bones are present, radius and ulna. Below elbow joint, two bones are present, radius and ulna. In hand, 8 tarsals, 5 metatarsals and 14 phalanges are present. There are total 30 bones. So in one upper limb, 30 bones are present, and in both 60 bones are present. Humerus. Humerus is the longest and largest bone of the upper limb. It is the longest bone of the upper limb, not of the body. So if we talk about this upper limb only, so in all these 30 bone, humerus is the largest and the longest bone. Now it consists of proximal end, shaft and distal end. This is humerus. This upper extremity is called as proximal end. This lower extremity is called as distal end, and the center is called as shaft or body. Proximal end, shaft and the distal end, and these all have different important anatomical landmarks. Some of the landmarks are labeled in this diagram. This is proximal end, this is shaft, and this is the distal end. Humerus runs from shoulder to elbow. As we can see in this picture, it runs or starts from shoulder to elbow. It connects with the scapula. Scapula is a bone of shoulder girdle at proximal end and with radius ulna at distal end. At the proximal end, this is the proximal end starting point of the humerus bone. Upper extremity is called as the proximal end. This proximal end connects with the shoulder girdle. You can see this proximal end connects with the shoulder girdle. It connects with the scapula bone. This triangular bone is the scapula bone. So humerus at proximal end connects with scapula, and at lower end, at elbow joint, it connects with radius ulna. Okay, at proximal end it connects with the scapula, and at the distal end it connects with radius and ulna. There are different landmarks at proximal end, different landmarks at shaft, and there are different anatomical landmarks at distal end. Proximal end, we can also call proximal end as upper extremity. It has head, neck, greater tubercle and lesser tubercle. Tubercles are basically present, rough area present for the attachment of muscles. So total 4 landmarks are present: head, neck, greater tubercle and lesser tubercle. Shaft or body is cylindrical in shape. Rough areas present in shaft or body, which we call as deltoid tuberosity, which is for the attachment of deltoid muscles. And at lower extremity, distal end, 2 epicondyles are present, 2 processes are present named as trochlea and capitulum. 3 fossa are present: radial fossa, coronoid fossa and olecranon fossa. At proximal end, head, neck, greater tubercle and lesser tubercle are present. In shaft, deltoid tuberosity is present. And at distal end, 2 epicondyle, 2 processes called as trochlea and capitulum are present. Anterior foci, radial fossa, coronoid fossa, and auricular fossa, they are present at the distal and this end of the humerus. We will discuss it further in detail, these landmarks.